Today, we're exploring a commitment New York State has made that could change the lives of hundreds of thousands of children, cutting child poverty in half by the year 2031.
Our guest today is Kate Breslin, President and CEO of the Schuyler Center for Analysis and Advocacy, a 150-year-old organization in New York that has been holding government accountable on behalf of children and families experiencing poverty.
Kate Breslin, thank you so much for being with us today. You've been such a good friend of the podcast, Lo, these many years. We think as we record this that we are approaching something, as David would say, the concept of a budget, an agreement here in New York State with Governor Hochul. What can you tell us?
Yeah, so I will say that New York's budget year started April 1st, 2026. So once the budget goes past April 1st, 2026, it's a late budget. And this is actually the latest budget we've had in quite a while. It's not the latest budget ever. We're in the first half of May right now. The governor announced last week that there was the beginning of a plan. And then a few minutes later, legislative leaders said, no, not really, there's not. So we are all, doing the work to try and understand what agreements they've come to, what agreements they haven't. Over the last, I guess, month and a half, they've been talking about some issues that aren't particularly budget issues, but that are policy issues. So things like how New York and New York's localities will interact with immigration and customs enforcement, sort of the aggressive ICE enforcement. The governor had a proposal on the table to reduce car insurance rates. So there have been some non-budget issues that have sort of seeped into budget conversations. And in some ways, a lot of the other conversation has just stopped.
Right. So, but Kate, we want, since we know that you've been keeping an eye on what's in the New York State budget for our kids, tell us what you are looking at and what you hope will come through.
One of the big ones that we are really invested in and working on is related to childcare. And here in New York, if you live in New York, you've been hearing that our governor and the new mayor of New York City are really together invested in getting to universal childcare. So we're thrilled about that. This governor has invested more state dollars in childcare than anyone else over the last several years. So expanding eligibility for childcare assistance, which means increasing the income levels that allow people to get childcare assistance. And both the governor and mayor are hoping to get to the point over the next several years where we have childcare that's universally available, just like public school. And one of the important things that we're keeping an eye on is the workforce. So one of the things that will keep us from getting to universal care is that we don't have enough people providing the care. And the biggest reason is because childcare providers are among the lowest paid people in the entire state. They're among the very lowest paid people in the state. And so we have lost, during the pandemic, we lost childcare providers. We continue to lose capacity. There are classrooms, childcare classrooms that are empty because there aren't the staff to provide the care. So one of the big things that we've been working toward is getting an increase in funding for childcare providers. So that is, as far as we know, still a possibility. It's still on the table. And that the request is $500 million for childcare providers. And then another one is expanding the childcare assistance program. That's the program for low-income people to apply and get what used to be called a voucher. And right now, despite this big, beautiful confluence of interest regarding getting kids into universal childcare, there are waiting lists in more than 30 counties and New York City. So we are sort of missing a lot of children and families right now. So we also need an investment in the child care assistance program to make sure that our low income families can get into childcare.
Mm.
And we need both,
Yeah,
right? If we don't have the workforce, we can't do it. And if we don't have the childcare assistance dollars, we can't do it.
yeah. I'm in Los Angeles, and I have a 2.5-year-old who, I'm paying close to what I paid for Vassar my first year, Vassar College, just to afford all the different pieces of childcare I have to assemble. So that really resonates with me. Um,
We hear you. We hear you. It's true for so many people. It's the largest.
yeah,
Yeah.
the largest cost, and which is incredible to think about, especially as I kind of lack the immediate family which sometimes surrounds you to help that out. Just jumping back, can you tell us a little bit about the center you lead? I was looking at it. I didn't realize at first it was founded in 1872, and I was thinking about America in 1872, and I started writing down things that I knew. Women couldn't vote was the one that rose to the top. It was a different world. It was just a decade after the Civil War. What does it mean to you for leading an institution with that kind of legacy? And how does that history shape what you're doing today?
I'm so glad you asked that question. Monday, May 11th, was the 154th anniversary of our founding. And so we're 155 years old, and we were founded by a woman, Louisa Lee Schuyler, the great-granddaughter of Alexander Hamilton and General Philip Schuyler. And
We've heard of them. We've heard of them.
Right, exactly. Most of us have heard of them. And I like to reflect on why did she do this? Why did this happen 154 years ago? And especially, this woman, she had helped sort of get involved in and help lead what became the American Red Cross during the Civil War, providing assistance to people who were involved in the war. And after that, she, and together with her sister, visited poorhouses in New York State. So that was an era where we institutionalized poor people. Some would say not a lot has changed, but it looks different today. But these were poorhouses across the state in most of the counties, where poor people were sent away. And often it was just children or moms with children, adult. It was sort of a mix. And she was appalled at the conditions in the poorhouses. Often no running water, no heat, no place for people to go to the bathroom. And so she created visiting committees of sort of her like-minded, somewhat well-to-do people, created visiting committees around the state to document the conditions in these poorhouses. And then they marched themselves to Albany and said, here are the facts. This has to change.
Mm-hmm.
And
sounds like you're still doing that.
And that's what I like about it. It's holding government. I see our role as holding government accountable to what it should do.
And here you are, Kate, lo these many years later, still doing that same work. Even the idea of a poorhouse, I mean, that conjures up present day images, for all of us who look at the unhoused and, the sheltered, in New York City, for instance.
Oh, yeah. Or yes.
Yeah. So it's still, so that work is still, one of the things that, David and I were talking, about this of when you look at New York State, for instance, what do you see in terms of the poverty? I mean, are we talking about, zip codes? What do you see for the state where the big poverty pockets are?
I think most people would be surprised at how many children and families are experiencing poverty, because you might not see it in your day-to-day life if you don't choose to. I drive from my home into my office in Albany every day, and if I'm not paying attention, I'm not necessarily seeing that in New York, it's almost 1 in 5 children experiencing poverty, and many more than that who are maybe just above that arbitrary line. And in some of our communities, including some neighborhoods in New York City and in some of our upstate cities. It's almost half of the children are experiencing poverty. And when
Yeah.
we're talking about that, that's such a low level of resources that it sort of bends the mind how folks can even survive. So the data are mixed, and it's across New York State. I want to make sure that people understand it's not just just a New York City problem or just
Sure.
a city problem.
New York has taken steps to address this. They passed the Child Poverty Reduction Act in 2021, committing to cut that rate then in half by 2031. You helped lead that effort, and I'd love to know more about how you got a law like that passed. What does it require the state to do, and how are you doing?
That's a lot. Yeah. Well, we
Pick one of the three.
we know that like addressing poverty and child poverty is going to take a lot of different things. There's no one magic solution, right? It's all the things. What that law did that passed in 2021, it passed with nearly unanimous and bipartisan support. And that for me is inspiring because it tells me that all of our state legislators, our policymakers understand that this is a problem and that they want to solve it. And it was this Governor Hochul, who signed it. And so what it does is it creates an expectation that we will take steps to reduce child poverty. It also, I hope, it helps people understand that there are policy solutions that will address poverty. I think a lot of people say, well, there've always been poor people. It's always going to be like this. We've seen policies that work, that reduce poverty. And so what the law does is creates an expectation and articulates an understanding that policy can make a difference.
Yeah, Kate, 2031 seems like right around the corner to me, though, in terms of, David's question of how are we doing? I mean, are we going to cut it in half by then? Is that the way what you're feeling now?
We're about halfway there. I mean, time-wise, not in. I think what's hard, right? There are a couple things that I will say, and that is our data is a little bit on a lag. New York has implemented some fantastic improvements at starting with what was identified as having the biggest impact, likely to have the biggest impact, and that is structural changes to our child tax credit in New York State. The most important changes are that now the lowest income people can get the credit. You used to have to be at a certain income level to even get it, and then you slowly phased into it. So without getting too wonky, right? Now the lowest income families qualify for the full credit. And the amount of the credit has been increased.
Okay. So if you were too poor, you didn't qualify for help.
Correct.
Ah,
Breathtaking, isn't it? Breathtaking.
well,
Right.
we've had conversations with a lot of very smart people, and I'm sure there's a rational reason that someone would articulate why that makes sense. It's not someone pulled that out of their nose. But if you just say it aloud, sometimes just looking in the mirror is a good answer. Sunshine, cleaning up the insanity. Tax credits come up a lot in your work. The child tax credit, the earned income tax credit. Really simply for folks that are listening who aren't policy wonks, but love Carol's voice, can you explain why a tax credit is this consistent, powerful tool that comes up for reducing child poverty? What does it mean for a family? How does it manifest? Explain a little bit for folks who may not be in Albany every day.
So for me, what's one of the beauties is, and I kind of counter this with, yes, it's wonky, but one of the beauties is its simplicity in the sense that everyone's eligible, right? You can file taxes. You don't have to submit proof that you worked 3 days last week. There are so many other sources of assistance or resources where you have to do a whole lot of proving. Now, granted, you do have to file taxes. So what's beautiful about it, and in New York State, people who file taxes without a social security number, So those are usually immigrant families. Those children are eligible too, which is also a beauty of this tax credit. That's one of the reasons we thought it was especially exciting. And what it means is it's cash in people's pockets that nobody's telling them what to do with, right? So for children under 4, the amount got increased from $333 to $1,000.
which is significant. That's great.
And it's available to families from low income to middle income.
So if I could translate, Kate, tell me if I get this right. If you have a child, you get a check.
Yeah,
you file your taxes.
You get you get a check. And even if, so refundability in tax terminology means that even if you're low income enough that you don't owe taxes, so your income, you might be working at a really low wage job and you don't owe taxes, this credit is refundable, meaning, yes, you get a check. That's like your tax part of your tax refund.
Yeah, Kate, you and I were very much fond, though, of the child tax credit that actually sent a check on a monthly basis that would actually
Yes.
be able to help people, as the year went along. So I think that's the goal somewhere, federal, state, everywhere, that, that there would actually be money coming in over the course of a year, as opposed to after you file your taxes, sometime in your refund, you may get a check of a certain amount of money.
And there certainly is an effort underway here in New York to, now that the amount has increased, back when it was a maximum of $333, getting it periodically throughout the year just sort of, you would, it
Yeah.
seemed.
So, Kate, I did want to ask you about one thing that may be standing in your way, and that's the new SNAP requirements that insist that some people now have to show either actual work, or looking for work, or whatever. And if they can't, then they are cut off from the meager amounts, in my opinion, that are given to people, to feed their families.
Right now, we are working sort of with our state partners around how that's implemented. The state has to implement that. And so they are trying to make it here in New York State. I think there is a good understanding that people need food. People do want to work. They're working if they can work. There's an effort to try and, of course, follow the federal law, but make it as seamless as possible for people. And so that's in SNAP or food stamps, and in Medicaid, which is health insurance coverage for low income people and people who have disabilities. The same work requirements are being implemented over there. So I want to give our state agencies here in New York credit, because they are trying to figure out how to make that
How to do it.
people. But I think that what's really hard is, at the same time, that same bill that created those policies at the federal level also is reducing funding that comes to the state. So the state's asked to implement a whole bunch of new rules at the same time that funding is being pulled back. So we're very much looking to New York. New York is a relatively wealthy state. We are eagerly, pushing our leaders here to figure out how do we protect New Yorkers from some of the harms that these federal laws have caused.
Kate, we have to have you back on. What about every podcast? You could come on and give us, an update. How are we doing?
That's fast.
Right. Where's the budget? Kate will be our third co-host, to tell us how we're moving this along. Interesting. Sergeant Shriver, who created the war, or what they call the war on poverty, has a new book out, in terms of what they attempted to do in the 1960s. And apparently it has not come to full fruition. But so many programs were actually installed. What do you see as the future of this war against child poverty that we're all in? 60 years from now, will we still be, looking at what happened and didn't happen? And we expect you to be there.
I think we are working hard to make sure that regular people and our policy leaders understand that there are things they can do. And what I'd like to see them do is each time they do a budget, a budget proposal at any level, including some sort of an analysis of what impact will this budget have on people at the lowest income levels in our community, whether that community is, Albany, New York, where I'm sitting, or New York State, or the nation. So as we think about the budget, think about very specifically and concretely, how will these policies impact people experiencing poverty?
I think it's genius. I've always thought we should issue a child poverty score on budgets. So really simplify it. I think the HRC Equality Index is a good model, or GLAD studies representation in media. Very simple, gives people a letter grade, boils it way down. I think sometimes we have to remember that folks in office have to get elected. And so if we're not simplifying this and helping them, arm them with a case to make. So I think representing what a budget represents is our values. And when you spend money, you're representing your values. I think we talk a good game, but with the perpetual state of poverty, I have at least 10 more questions. One thing I was curious about, though, before I lose this thought, I was really struck by your time overseas. And I'm curious about how, having traveled abroad myself, how did your experience in places like Sierra Leone as a Peace Corps volunteer, how does it affect how you see poverty here? I hear people talk about poverty. Well, they have a smartphone, or they say things of that nature. How does that affect what you do today and the way you talk about it, or just in general? What does that time mean to you, and how is it manifesting in your work?
My time, especially in Sierra Leone, is sort of invaluable to me. And I still have friends in Sierra Leone. And I think when you go to parts of Africa, especially, you see poverty very differently than you do here in the U.S. And I wrestle with that because, people are experiencing deep, deep, deep deprivation. They're often in places where the government doesn't have the resources, or maybe the government does have the resources and they're, putting them somewhere else to help. But at the same time, I think, I hear people say, well, here in the U.S., like, people have poor people have cell phones, they have television. Why should we worry? And I think the evidence is clear that experiencing that level of deprivation anywhere in African countries, it has lifelong consequences when people are malnourished, for example.
Mm-hmm.
And I think anywhere you go, that has consequences. At the same time, I've been digging in a little bit on income inequality, and that too, in and of itself, is harmful. And here, we're in a moment, I think, in the U.S. where we're seeing that grow. And beyond just poverty, income inequality is also very damaging. And so I think we need to be thinking about that, certainly both in the developing world and here.
It sounds like you see them, interrelated. And even if someone here has a different level of deprivation or struggle, I always think about everyone's Mount Everest is proportionate to themselves. So it's the context they're in, the struggle they're in. So it's not better or worse, it's different. And it's important that we understand that. I think sometimes people denigrate poverty in America with the sense that, well, they have cable. Or today they have a subscription to, a streaming service. But that's really interesting and important to me to know. And I appreciate that, your volunteer service.
Kate Breslin, thank you so much for being with us. We will see you again plenty of times. Good luck with that budget. Keep us posted.
Keep fighting.
All right. Thank you so much. Bye-bye now.
Thanks for being with us. Be sure to check out and subscribe to our YouTube channel.
You can also find more information about our guests, and we have show notes and all of that, and about the podcast and the other events and volunteering that we're doing on our website, theinvisibleamericans.com. Thanks for being with us today. We'll see you the next time.